Afternoon, everyone. Today's session is going to be really helpful and is led by Dr. Krishna Swarup. He is going to talk about accident prevention in children. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Hello, good afternoon, everyone. I'm Dr. Krishna Swarup Reddy, Senior Consultant in Pediatrics and Neonatology, Apollo Cradle and Children's Hospital, Jubilee Hills, Hyderabad. Next, not getting anything. Oh, no, today I'm Today I'm going to talk to you about accident prevention in children. Accident in children is one of the major mortality and morbidity all over the world. What is the definition of next slide? Sorry, not able to get to the. According to WHO, an accident is defined as an event that occurs suddenly, unintentionally, unexpectedly, and which results in injury or damage or death. So, if you see globally, unintentional injuries such as road traffic crashes, drowning, falls, burns, and poisonings are the leading cause of death for children and adolescents. If we can see the number of deaths which occur every year all over the world. Next. Why children are more prone for accidents? The key factors are because their their dependence on caregivers, because their lack of supervision increases the risk of accidents for children dependent on caregivers. Curiosity and exploration. Children are naturally curious, that their curiosity can lead them into unfamiliar, hazardous situations. They are very impulsive. Young children may act impulsively without fully considering consequences, elevating accident risk. Coordination and motor skills. Developing these skills take time, leave young children prone to trips and falls. Developmental variability. Children different ages have varying levels of physical, cognitive, and emotional development, leading to accidents at different stages. Inexperience and limited knowledge. Developing cognitive motor skills leave children inexperienced in assessing and avoiding damages. Limited risk prepared perception. Children may not fully grasp the concept of risk, engaging in activities adults would deem unsafe. Hazard recognition. Children may not recognize potential damages in the environment. Limited safety awareness. Children may not understand safety measures or their consequences of certain actions. Play of nature. Children are very playful. While play is essential, it can involve risk activity if the environment is not adequately child-proof. If you see age and development related accidents, the phases, most common injuries, if you see from 0 to 5, the child begins to roll, then crawl, then walk, climb mostly within house and immediate surroundings, and attract to colors and fluids which are easily accessible and to putting things in the mouth. They're not able to distinguish dangers. This cause the most common accidents in these age groups are poisoning, burns, drowning, fall injuries, and RTIs, and in unsupervised parental condition. Between children between 5 to 10 years, schooling and socialization leads to more independent yet supervised exposure interaction with external environment, exploring various possibilities to develop a sense of competence and judgment. So the RTAs and falls and violence and poisoning are the most common injuries in this age group. Whereas in 10 to 18 group, the child attains puberty, their physical and psychological and socio-cultural changes, more unsupervised exploration of environment, but logical thinking starts to develop. Peer pressure and social expectation leads to impulsive movements and decisions. So they get into RTIs, falls, burns, drowning, sport injuries, and poisoning. The common childhood accidents, typical WHO typically categorize these injuries into various types: falls, drowning, burns and scalds, choking and suffocation, poisoning, traffic injuries, sports and play injuries. Falls are injuries resulting from child descending from higher level to the lower level or on the same surface. Drowning injuries related to submersion in water, whether in bathtub, swimming pool, or natural body of water. Burns and scald injuries caused by exposure to heat or chemicals. Choking and suffocation injuries that occur when a child's airway is blocked, limiting or preventing breathing. Poisoning, harm caused by ingestion or coming into contact with harmful substances. Traffic injuries, accidents involving vehicles such as pedestrian accidents or car crashes. Sports and play injuries, injuries occurring during recurrent recreational activities or organized sports. If you see all over the world, home accidents are the major accidents in the childhood. 31% of childhood accidents occur at home. If you see in the house, the falls are the most commonest, followed by burns, the cuts and injuries, and burns and drowning, and followed by poisoning. So home is not very safe unless the safety is provided. The what are the fall? Fall is one of the major accidents at the home. What are the causes of fall? Unstable gait of the toddler, presence of objects on the floor, lack of supervision, curiosity of children, etc. may cause. So how do you prevent this? Keep floors free of toys and obstructions. Exercise close supervision when toddlers learns to walk. Never leave babies unattended on raised surfaces. Even if you want to get a diaper, take the baby with you or call somebody. Don't put 3 4 pillows around the baby on high surfaces and go away. Check constantly floor surface for wear and tear. Keep floor dry. Always ensure bed rails of the baby cot is raised when the baby is in the cot. Always use a security fitted safety harness in pram, pushchair, or high chair. Windows and doors must be locked to avoid misadventure by children. Avoid placing step stones such as chairs next to the window. Take extra care to avoid side turning of a baby chair. Fit safety gates at bottom and top of the stairs. Walkers have high rate of accidental injuries and we do not recommend walkers. Studies have shown that use of walkers hinder proper muscular development for standing and walking. So we don't recommend walkers. A wooden and the playpen. A wooden playpen should have slots no more than 4 inches apart. Buttons on your baby clothing should be larger than the netting holes in the mesh. Playpen to prevent button being caught and possibly choking your baby. Check to see that the playpen is sturdy and has no sharp edges. Keep the side up babies in the playpen. Provide close supervision. The crib safety. Place your baby on his or her back for all sleep time. The babies who are kept sleeping on the belly or the side have sudden infant death syndrome. Use a firm, flat sleep surface, such as mattress covered only by a properly fitted sheet. Keep your baby's sleep area, for example, crib or bassinet, in the same room where you sleep until your baby is at least 1 year old. Place the crib to your bed so that the baby is within the view and reach and can and also help make it easier to feed, comfort and monitor your baby. Crib safety. Keep soft bedding such as blankets, pillows, soft toys out of your baby's sleep area. Keeping blankets and pillows increase the risk of suffocation. Additionally, do not cover your baby's head or allow your baby to get too hot. When some older children are made to sleep on the bed, it will be wise to keep some cushions mattress on the floor by the side of the bed. Keep the main door of the room open and bathroom attached to the room bolted when going outside for some work or for a while. Now we'll talk slightly about car safety. So whenever we're taking children in the babies in the car, never whoever is holding the baby should not sit in the front seat. Should be sitting in the back seat. It's more appropriate to use the car seat. Use an appropriate car seat. Infants and toddlers should be placed in a rear facing car seats in the back seat of the vehicle at least until they reach the age of 2. As your child grows, transition to a forward facing car seat with a harness and eventually a booster seat. Proper installation of car. How do you do a proper installation of car seat? Ensure the car seat is properly installed. Follow the manufacturer's instructions and your vehicle's manual to correctly install the car seat. Make sure the seat is securely fastened and doesn't have excessive movement. Harness straps and chest clips. Adjust the harness straps at or below the child's shoulder for rear facing seats and or above the shoulders for forward facing seat. The chest clip should be positioned at armpit level to keep the harness in the correct position. Keeping children rear facing as long as possible. Never leave the child unattended in a vehicle, even if it is just for a short period. Never leave a child unattended in a vehicle. Temperature inside the car can rise quickly, posing serious risks to the child's health. Secure loose items. Don't ensure that loose items in the car, such as toys and other objects, are securely stored. In the event a sudden stop or crash, unsecured items can become projectile. Regularly check and adjust car seats. Regularly check the tightness and positioning the car seat. Straps should lie flat with no twist, and the chest clips should be at the armpit level. Educate caregivers. Make sure anyone who transports your child is aware of and follow proper car seat safety regulations. Follow weight and height limits. Lead by example. Always wear your seat belt and make sure everyone in the vehicle are properly secured. Children are more likely to follow safety rules if their adults do the same thing. How do the first aid for the fall? Don't panic. Call for help if necessary. Check the level of consciousness of the infant or child. Examine the child, airways, breathing, and circulation. Check the airway whether the baby can talk or cry or not. Breathing, see if they are breathing adequately. and circulation. Observe the color of the face, depth of the rate of breathing. If breathing and circulations are normal, check for any other injuries on the body. If bleeding occurs, ensure that there is no foreign body in the wound. Apply direct pressure to stop bleeding by covering a clean gauze on it and adding pressure on the gauze by your hand. Elevate the injured limb. If deformity is seen on the injured part, do not move it and call for help immediately. The next, drowning. Drowning is one another second most common cause of mortality and morbidity in children. Drowning is one of the leading cause of death among children also. Children can drown in less than 3 centimeters of water, so it can happen both in bathtubs, toilets, buckets, swimming pools, and open water. They should be under constant supervision in or near any water bodies. How do you prevent drowning? Never leave children or babies in the bath unsupervised even for a few minutes. Never leave uncovered bowls or buckets water around the home. Paddling pools should be emptied and stored away when not in use. Garden ponds should be filled in while children are small or securely off. Take special care when visiting other people's gardens. The first aid of drowning, call for help, dial emergency, remove the child from water as quickly as possible, check for responsiveness, place the child on the back on firm surface, check for responsiveness by tapping the child and shouting, look for signs of breathing. If necessary, do CRP. If the child is not breathing, start CRP. At least push hard and fast on the center of the chest as the rate of least 100 to 120 compressions per minute. If anybody who knows CPR should provide rescue breathing as well. Continue CPR until help arrives. Monitor and reassure. Keep the child warm and monitor their breathing and responsiveness until professional help arrives. Reassure the child if they are conscious and responsive. Choking. What are the causes of choking? The accidental swallowing of foreign body or accidental strangulation, covering of a head by blankets, accidental suffocation by pillow while baby is sleeping in prone position, or near drowning can all cause choking. How do you prevent choking? Choose toys appropriate to age of children. Avoid toys with detachable small parts. Ensure small objects are kept out of reach of children. Pull cords and curtains and blinds should be kept short and out of reach of children. Strings and plastic bags should be kept out of reach of children. Instruct children not to play while eating. Never let children use milk bottles by themselves without adult supervising. Never use pillows for baby under 1 year of age. Do not use large and heavy blankets. Never let blankets cover the face of children during sleep. Avoid sleeping with the baby on the same bed because you may roll over the baby. Never leave children alone in bathtub or basin filled with water. Buckets filled with water must be covered and chil- keep children away from it. How do you, how do you first aid for choking? Do not panic. Remove the cause from the patient by Heimlich maneuver. Call for help immediately. Perform CPR if necessary. Scalds. Scalds by or caused by hot water, burns by fire, touch on hot objects such as cooking utensils, etc. Burns and scald prevention. Never hold a hot drink, food while holding a child. Ensure milk and kanji and other foodstuffs is at reasonable temperature before feeding. Ensure proper fence or door is installed at the entrance of the kitchen. While cooking, pay extra attention to the stove, fire, and cooking utensils. Turn the pan handle away from the front and close to the wall. When giving a bath for a child, always test water temperature beforehand. All hot objects, including an iron, containers with hot matters, must not be placed near the margin of a table. Avoid using a tablecloth. Matches and lighters should be placed away from the children. Install proper cover to uh, sockets. Warn children never to play with fire. The first aid. When children are small, use caution. Avoid touching fire with hands.
You can continue, sir.
No, no, really. I don't know what.
Which is slide?
So, no.
ఇదే కదండి సార్ పోయింది.
Burns and prevention. అయిపోయింది నెక్స్ట్ బర్న్స్ అండ్ స్కాల్ అయిపోయింది
ఇది అయిపోయిందా సార్?
ప్రివెన్షన్ ఇది కూడా అయిపోయింది వాన్ ది చిల్డ్రన్ ప్లే విత్ ఫైర్ నెక్స్ట్
ఇదా సార్?
అయిపోయింది ఇది కూడా
అయిపోయింది.
చేసేసినాం
27, 28.
27 రాలేదే దాంట్లో ముందు conclusion.
You can continue.
Accident could not be completely avoided, but its occurrence could be prevented. To prevent accident to children, adults should pay more attention to home safety. They should also clear any hidden hazards at home and teach children about safety. If an accident happens, stay calm and call for help immediately. As a pediatrician, we have the responsibility to take time to explain to the parents or the caregivers about accident prevention so that accident prevented can save one child. Thank you.